Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Pediatrician versus Grandmother, choosing love over medical advice. Jessie, welcome back to the show.
Happy to be here.
All right, what's this latest article about?
This article is really about my own life. And this fall, my son, who I had in medical school, had his second child, but turned out to be second and third child. And the story is that they had opted to have a home birth and then had unexpected twins.
Hmm.
And as a pediatrician, you can imagine I was not aware of this. And I learned a lot through the process. And as I learned a lot and shared with physician friends, and many of my clients asked me, like, oh my gosh, how did you handle this? And so I did a lot of sort of personal reflection on it. And it was clear to me that this is a huge issue for many of us in medicine. It was a huge issue for me, just to be very honest. But this idea of when our family makes choices that are outside of our own recommended ways of doing things in healthcare, and how do we focus on that relationship and stay out of judgment, whether it's you and I have talked about aging parents, but whether it's your aging parents or your children on the other
Mm.
end, or friends and family. And a few bigger issues came up around this is it's partly not being asked, like what does that mean? Or when they do ask and you give advice and they don't follow it, what does that mean? And sometimes they ask and we think they ask too much. I have those family members too, right? And so it's pretty much a no-win situation for us in healthcare. And so it got me really thinking, well, how do we want to show up for these situations? And this very same week was the week that I gave a TED Talk on what would love do. And the two sort of dovetailed in this idea that your relationship with your kid and your grandchildren should be a loving relationship.
Mm.
It's not really about being a doctor. And that when you are a doctor, and in this case, a pediatrician around childbirth and babies, you can't not be a doctor at the same
Hmm.
time. And so many people said, oh, well, just don't be the pediatrician, be a grandma. I'm like, well, I can't do that either. I don't know how to do that. Like, that's actually not realistic. So, how do you intentionally move forward and
Mm.
recognize that nervous system trigger and all the thoughts that came up? The other piece that came up here that was really stressful for me was I actually felt judged by many of my physician colleagues. Like, well, how could that happen? And it clearly is out of your control, right? My son is very much an adult. He's married, has his own kids. And there was a lot of judgment from the sort of physician world about, you know, how they thought and were they not scientists. My son and his wife are actually both into science, very much
Mhm.
so. So I think in our world today, we have so much energy around this and judgment and conflict. And so I decided to write an article about it. It was
Yeah.
part of my way of processing. And when I shared this with people, I just got so much feedback about how helpful the thoughts and the framing were. So
So take us through that event. What was your role during that event? Tell us what happened.
my role was really nothing. I knew this was their second child, and their first child had been born in a hospital, and I had helped them get set up with a pediatrician and a OB. It was a birth center situation. But so this time I actually just made assumptions, and I have tried very much to be a gracious mother-in-law and a gracious grandmother, and been very intentional in those roles that I don't want to be the pediatrician or the medical person. And I'm always available for advice. And actually, I think I end up filling that role a lot. I am not someone who espouses like all in or all out. Like you have your doctor, go ask them, because
Yeah.
I think our system's so broken right now. That's not really fair. And if I can be helpful, I have good advice.
Mhm.
But I think if you're always helpful or you're always judging or always saying things, nobody listens to you. But what happened here is I literally got a text about the event on the other end that there were these beautiful twin girls that were born and photos. No one actually ever even used the word home, but it was clearly obvious from the photos that they
Mhm.
were at home. And as parts of the story came to pass, it was clear that that was a very intentional choice that they had made. And we actually haven't talked about it, which I think is better. It was really for me to process on my own how that happened. And I will say in the end, it all turned out fine. But in the
Hmm.
moment, my brain just went absolutely
Yeah.
haywire, and also haywire about, what they should do now and this and that and all these things and
Mm.
what could go wrong. And that was clearly not my role, but very hard to
Yeah.
be quiet and to recognize it took real intention that love actually wouldn't speak up and love wouldn't criticize and wouldn't judge what had happened in the past because that's not helpful. And thankfully, they were lucky and it turned out. It is also a reminder for us in healthcare that things actually do turn out well most
Mhm.
of the time, but our lens is all of the terrible things that could happen. And I think that intentional handling took a lot of thought and mindfulness and pausing and breathing on my part. And in the end, I'm very proud that it worked out that way. And I learned a lot from it, even as I carry it over to, I have a brother who's always asking me for medical advice about
Mhm.
his children. He's the opposite. He asks for more, and my parents ask for less. And even how to process the fact that I didn't know. I was
Mhm.
like, what does that mean? Are they rejecting what I do? They know I'm a doctor. Like, do they think I'll be upset? And my ultimate story would be that they're not telling me was actually loving because had I known, that would have been actually even harder for
Mhm.
me. And so in this case, I think that what's most important is my relationship with my son, my daughter-in-law, and my granddaughters, and I have my grandson, and knowing that they feel comfortable asking me questions. And I think being very purposeful in how we show up for those situations is what maintains the relationship and has left the lines open for them to ask me pediatric questions, which I am a good resource.
Yeah. So that intention not to judge, not to criticize, in a way, keeps you close to your family members
Yeah.
who would feel comfortable ask you questions that maybe if you put on your pediatrician hat, you would give
Yeah.
advice and you would judge, right?
Yeah.
So at the moment, it sounded like you had to pull all your coaching techniques and implement them
Boy, yes.
during a time of stress.
My
Now,
husband was stepping on my foot.
yeah, yeah,
Right? Well, it was clear to me. I think in part I was stunned. Like
yeah.
it had never occurred to me that this would happen. And I was thankful and worried. And so in that moment, it's always the pause of just we are trained to react, and my job was not to react and was to remember that my job here was I was not the medical provider. Nobody was asking me for advice. They were sharing this good news with me, and my job was to lean into that, and
Yeah.
it was great news. And so and to be supportive of what I think was unexpected and overwhelming on their part. And so for me to sort of figure out how to do that takes that inner awareness, which I think we often turn off in medicine. That being said, sometimes we're thoughtful about what not to say. And it's not really about what to say or not to say, but how to choose the role
Hmm.
that you have in different scenarios. So it's choosing the daughter role with your parents or the sister role with your brother or the mom grandmother role. And I think to be fair to ourselves to understand that I hear from so many people, don't be the doctor or don't
Hmm.
and you can't not do that because you know all the things. And so having compassion for yourself to say this is going to be super stressful.
So we talked about this earlier, pause rather than react. That
Yeah. Yeah.
that that is a tremendously powerful technique, and it came in very, very handy during this
Yes.
particular instance, right? But even at the moment, you as a trained coach, you just found it so difficult to even
Yeah.
do at the moment. And then can't
Absolutely.
even imagine how other clinicians, how some of your other
Yeah.
clients would have responded in a similar situation. And I assume that's probably why you felt judged by your other physician clients when you told them the
They
story.
were reacting, right, of
Yes.
course. And I think the reason that I was able to do it is because I do a lot of work with other people and myself about showing up with intention. And so I have been really clear, particularly in my mother-in-law role, about how I want to show up as a mother-in-law because that's such a noisy, emotional role. And so I really wanted to be a non-judgmental mother-in-law, and I really want to stay connected with my kids. And one of the things that I work with physicians and coaching on is this idea that we want our kids to be mostly healthy, mostly happy, mostly responsible,
Hmm.
mostly independent, but we also want them to want to have a relationship with us.
Yeah.
And we want to have a relationship with them. And that's the key thing. And so if I want to have a relationship with them, I can't show up as the naggy pediatrician physician who's always giving advice. It doesn't mean that I disregard everything. Like I did say, oh, wow. Well, I'm glad you guys got lucky. Right? Like that was kind of my version of I'm so glad that nothing went wrong.
Hmm.
Right. And so you can start to drop hints or be sure, I had said in the past my thoughts about home birth with their first child. So I'd already said it. Like there was nothing else to say. But I think we feel like we need to keep repeating it and repeating it and
Hmm.
repeating it. And we judge ourselves like, well, how come they didn't listen to me? Did I not say it persuasively enough? It had nothing to do with me.
Yeah.
But in medicine, we think that it does. We also think it's sort of rejecting this career that we gave everything to. And now they're rejecting that and they're choosing to do this in a different way. It's not about that either. But we're trained to take it pretty personally, as well as other people's comments. And so, and the not asking you, you take that personally too, potentially. And so it was a great reminder for me that it's not about me and a great reminder for me of choosing that intention and what's the energy you want of your relationships and just leaning into that, which is really love as a in most of our intimate family relationships. I think we get ourselves into a lot of trouble
Yeah.
when we show up with advice and knowledge couched as love. Oh no, it's loving to give them all this advice. And yet, I think for me, it's also loving for me to ask for my future self in that moment. Well, my future self would have recommended that they take those babies in to see a pediatrician, and I did. Right? Well, this is great. And
Hmm.
now I still recommend this. And my job is to throw it out there, to offer to help with the figuring out how to make that happen, but not to push or not. We think our job is to convince them or make them understand. And it reminds me a bit of the vaccine dilemma. It's not. Our job is to inform and to educate and
Hmm.
to share our knowledge when people ask for it, which they do when they come to you as a pediatrician, but not in this case.
Now, did you ever have a formal debrief with your son? And did your son ever come to you and say, "Hey, mom, what did you really think about this?"
No, he's not. And I think I mean, I actually think he knows exactly what I think. And I think maybe 5 years from now, he'll tell me that, like, thanks for not like creating
Hmm.
an issue. The other thing I think is when people have babies and twins, like, it is not the time to be discussing emotional, heavy emotional. Even now, these twins are a couple months old and they have got their hands full. And it's not that like there's all those postpartum hormones going around and nobody's sleeping. If my ultimate goal is a healthy relationship, that has to be the focus. And the only reason I think that that would need to happen is if I was still harboring some challenge and the work was for me to
Hmm.
work through this. And when I've talked to other people who've really struggled with family members who don't follow their advice, don't follow recommended advice and or ask for their advice and don't follow it, which is even harder.
Hmm.
Our job, it's really a the work as for us on the inside, and it's a very expensive, energetically and emotionally charged situation. And I think it brings a lot of resentment and judgment that it doesn't have to. And then we have these challenges with our family, which we don't need to have.
How did it feel to be judged by your physician peers and some of your coaching clients whom you told this story to, who may have reacted
Yeah,
and you said that you felt judged by them? How did
I
that
did.
feel and how did you manage those
Yeah.
emotions?
I initially, I think whether it was my own thing, like we're so trained to people please and have everyone like us. And so as you say it now, I'm like, well, I was probably judging myself a little bit too. How could this have happened? And they're all saying, how could this have happened? And why didn't this and that? And again, it was just the pausing and recognizing that everyone's going to have their own reaction. And I think that had this not been my own son and my own focus being on that relationship, I probably would have reacted the same way, right? We're
Mhm.
trained to do that in medicine, and we've talked about judgment. And so I do think it's this idea that imagine if we supported one another, which would is something that we can just work on in medicine by saying, oh my gosh, that must be hard as a pediatrician.
Yeah.
I bet that flipped you upside down. And that's not what we were trained to do, right? We're trained to figure out what we've missed and what could go wrong. And I think ultimately in the end, a lot of people said, I can't believe that, this is all, you're fine. And this is turning out like, and so modeling that I think was really powerful. But it reminds me, I'm hearing a lot again about physicians like not supporting other physicians, especially women. And this is not actually personal at all. But it's that we're just trained to react in that way. And we're trained to worry about the worst case scenarios and to jump in and to fix and solve and judge. And that's what we do. And so, just like that wasn't my role, other people are trying to take the same role. And so, what if in this world of medicine, we ask people, I'm thinking even when, there's an undesired outcome in medicine, like,
Hmm.
oh my gosh, that must be really overwhelming for you. How can I support you? Wouldn't that be lovely? That's not what we're trained to do, but someday we may be able to get there.
So I'm hearing that the fact that you stayed silent and not jump in with advice and your opinions that preserve the relationship that you had with your son, daughter-in-law, and your grandchildren.
Yeah,
Is that really the case? I just want to make sure
yeah,
because I
yeah,
completely agree because having that safe space, that
yeah,
non-judgmental space is a way to keep close contact. So tell us
yeah.
about how that has strengthened the relationship with your son and his family.
Yeah, that's actually funny because I would say, like, I wouldn't have thought this would do it. But the fact that I have just shown up fully as, how can I help and non-judgmentally, I do a fair bit of work. Like and I think this is true for any physician, parent, grandparent, right? When you're tired, you're not at your best. So I do try to like make sure that I take good care of myself and I go visit and I'm all in and helping, but not to the point where I'm depleted and then I say things I wish I hadn't said. So again, it's being very intentional. And this, having gone through this and me trusting that they did this for their own reasons that I may or may not understand, I don't even need to understand. This idea that you don't have to understand has been so helpful in coaching, and I think is something that so many physicians find helpful, that we don't have to agree on this. We can still love each
Yeah.
other, and I don't have to understand their rationale. They don't have to understand my rationale, and that my trusting them is allowing them to trust me. And I actually now get a lot of pediatric questions again,
Hmm.
and that's great. And I'm happy for that. And that is what I would like, especially as I say, with the chaos of medicine, it's pretty hard to get a simple question answered in a timely fashion. And that is something that I can bring. And so showing up non-judgmentally, we've talked about aging parents as well. Like when you show up non-judgmentally, you get a lot more questions, a lot more
Hmm.
information, and you can be a lot more helpful. And so having been through this and showing up non-judgmentally has really strengthened the relationship and strengthened our conversation. And I could see the next question like, well, what if this happens again? And I think I would ask,
Hmm.
like, oh, what are your plans?
Yeah.
And I'm so glad it worked out last time. I still have the same opinion
Yeah.
about this, from my training. But again, we all get to have our different experiences. One of the other things that this brought up for me was a real grief and sadness around how our medical system works right now, and that pretty highly educated people who I think are pretty reasonable are opting out because of some of the challenges of getting care and the processes and the way it feels to be in the system, and that makes me sad,
Hmm.
really sad.
I've heard one piece of advice for others in that situation is before you say anything, just ask, do you want me to be a pediatrician or do you want me to be a more supportive role? What do you need from me right now? And let them guide you in terms of how you can respond.
Yeah, and I will say, I think my son has learned quite well. He's like, I'm calling you for pediatric advice, is what he'll say sometimes now,
Hmm.
as opposed to, Mom, what's your thought? Like the questions are framed very
Sure.
differently. And I think that setting that up is really, really helpful. And over time, I think my family's pretty good about that. We need your doctor advice.
Yeah.
Or, it's clear they're not asking about it. I don't know what to do is not, I need your doctor advice. But I would agree being really, really clear and that when it's the pausing to be clear what your role is and
Hmm.
who do you want to be so that you can maintain those relationships. And I think being a physician is so much a part of us. It's a real challenge to step out of that, even when you're not being asked to show up in that role. So it just takes a pause and tremendous compassion and that intention. I often help people really be clear about what their intention is in their relationship with their kids. What are the feelings you want to have there? Because we get very focused on achievement or on what terrible thing could happen. And being really clear, well, if you want to have this long-term healthy relationship with your kids, which is much longer as an adult than it
Mhm.
is under 18, and bigger stakes things keep coming up as this story makes clear. I mean, I would have said this would never been part of my story at all. I thought, it just was never something that had crossed my mind. And so there was real learning in it. And I know from hearing from so many people that they have had experiences that have felt the same way internally, and our natural reaction is just so strong. And so how do we have the wherewithal in the moment to grow that pause? Mindfulness is the key to growing that pause, and I guess that's where I got it from. That's what I teach. But to recognize, I think many of us are like, it's not that useful skill. But if you grow it over time and you
Mhm.
practice it, you lengthen the space between the stimulus and the response, and it gives you those nanoseconds that allow you to catch yourself in the moment so that you can show up with love for the people you love.
Is your son and daughter-in-law, are they aware of whatever you're describing here in this podcast? What if they saw this podcast? What do you think their reaction would be?
Well, I've thought about that because I originally said, well, I can't. People said, you really need to share about this. And I said, oh, no, I can't. And I think that, I mean, my framing is that they did what worked for them. And
Mhm.
I actually, in many ways, am proud that when, if my child or his partner believe in something strongly and that's what they want, that they did what they believed in. And I am actually kind of proud of how we and I navigated it in the sense that I feel pretty not judgmental at this point. In fact, as a physician, I think it's really super helpful to see that people that you love and trust and respect and make decisions that are different than you might recommend. That has been a really powerful experience. And so I'm hopeful that if they were to listen, that they would see that this was more of a learning experience on my end, and that they would feel really good that I leaned into the love piece and that that was what was most important to them. Part of me is like, yes, I hope they appreciate all the work I
Mhm.
went to. But in the end, I'm not sure. That's not really the point. It's funny, that's your doctor. Like, I wonder if they even
Yeah.
noticed. I don't know. But for me, it's really about the growth and learning on the physician end because our tendency is to judge people, whether it's those people we love or to judge each other, or which is really funny because, the what my children do is not actually a reflection of me. But in medicine, we always make people's behavior a reflection. Like if your patient does something, it's a reflection of you as a doctor, but it's not actually in your control. What's in your control is what you share with them and your beliefs and the energy you bring, and what they do with it is on them. So it's having it be someone in your family is very clarifying of that.
We're talking to Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Pediatrician versus Grandmother, Choosing Love Over Medical Advice. Jessie, as always, let's end with take-home messages they want to leave with the Kevin MD audience.
My message is to, as a physician, one, we can not separate that out from our identity. It will follow you whether you're a mom or a grandmother or a daughter, but to choose your relationships and be intentional about how you want those to be, and to own what is yours. And as you mentioned, to figure out whether people are asking for your advice or not, and be thoughtful about the right places and times and spaces to share it so that you can allow what matters most to you to be healthy and whole.
Jessie, as always, thank you so much for sharing your story time and insight. Thanks again for coming back on the show.
Thank you for having me.